Most people living in cold climates are very familiar with the gutter icicles, as you can see here over my right shoulder. But as an ER doc, when I see these, it makes me think of a very unique and interesting case. And this is one that you are not going to see on shows like The Pit. Many years ago, I'm taking care of a guy in the ER, and he is complaining of excruciating abdominal pain. And this dude looks pretty sick. I'm talking like fetal position, clutching his abdomen, vomiting, and having abnormal vital signs. Says the symptoms started about 3 hours ago, no other history provided. Examination of his abdomen reveals it to be distended, rigid, and tender diffusely. Subsequent CT imaging revealed a surprising diagnosis of a large amount of extraperitoneal air. That's air that exists outside the lumen of the GI tract where it's not supposed to be. A finding like this would typically indicate a life-threatening diagnosis of GI perforation. Problem is, on the rest of the images of that scan, there was absolutely no indication of anything infectious, inflammatory, or consistent with that diagnosis. So what do you think? Anybody willing to take a stab as to what actually happened in this case? Well, as the OR team is literally whisking this guy down the hallway for an exploratory laparotomy, a timid, tearful, and highly embarrassed girlfriend steps out into the hallway asking to have a private conversation with me. Turns out, homeboy is just a bit more freakish than your average bear. One of his fetishes included convincing her to sodomize him with one of these giant frildos. Their freak-off session that morning had gotten a little bit out of hand, causing her to lose grip on the icicle, at which point it progressed further into the intestine and caused that perforation. We did not see any evidence of the retained foreign body causing the perforation because, of course, by that point it had melted due to his body temperature. And for that reason, I can never see one of these giant icicles hanging off a building and not think of the story of the Pittsburgh Acicle.